Hello everyone and welcome to another episode of the A&H Berts Stockpickers Podcast with Albert and Hubert.
Here, each week, you can join us in discussing our favourite stocks where we can help you find your next investment opportunity.
We aim to present and discuss the investment thesis for our top picks.
Let's get right into this week's choice. Today we have a special guest joining us to pitch their choice.
So it brings me great pleasure to give a warm welcome to my old friend Lukas, also another Durham student. A little background on Lukas: he's a chemistry student at Durham, and we wanted to get him on to give his take on something a little bit more sciencey, something we didn't have the expertise on to cover. In terms of stock investment, Lukas and I actually got into stocks together quite heavily last year, and we've always, this has always been a topic of discussion for the two of us. So without further ado, it brings me great pleasure to hand over to Lukas to present. Lukas, take it away.
Well, thank you, Hubert. Thank you, Albert, for having me on. It's a great pleasure. I'll be pitching Roche Holding AG today, commonly known as Roche, and I'll be discussing with you what it can offer for potential investors, some of the background points and the risks. So, Roche is one of the largest pharmaceutical companies in the world. Market cap 336.86 billion Swiss francs. Second largest in Switzerland behind Nestle. And the ownership has some family stuff. Novartis owns a further third. And of course, the public investor can buy the other shares. Founded in 1896, some of their landmarks include being the first to synthesize vitamin C, introducing benzodiazepines and also antidepressants in the 50s. And so when we look at the points as to why the stock is a buy, there's the innovation, there are Roche's financials, and then also the fact of it being a Swiss company, which is very important. And so in terms of the innovation, when we look at the pharmaceutical industry, innovation really is central to generating products, having a successful business model and one that's stable and one that lasts. And Roche excels in this. For example, in 2020, they spent 13 billion francs on research and development. And this investment in research and development has been growing since 2011. This is the highest for any pharmaceutical company in the world, the audience may wish to know. And when looking at their reports, they describe themselves as being committed to personalised healthcare and taking a holistic view of the healthcare system. So linking prevention, diagnosis, treatment and monitoring in medicine as a whole. This helps to reduce complexity and cost, by the way, which is very important. And they also use data and technology to drive things like, AI, for example. And they also believe very greatly in collaboration, various partnerships, which we can, of course, get into. And so what better place to start than the global situation that we all seem to have embroiled ourselves in by no choice of ourselves. COVID-19. They started drug research immediately in 2020, seeked out partners. For example, one of the latest medicines, which was approved in November 2020, two molecules which I continuously fail to pronounce, one of them called imdevimab. The way this works is they are antibodies that do not compete with each other but neutralize the antibodies of the virus. And so this is a very powerful antiviral. Emergency use so far, but we'll see what happens with that. And they also partnered with a company called Atea to give an oral antiviral. And of course, intuitively, oral drugs are highly desirable because they're very easy to take, no injections. Simply pop a pill and the pharmacological effect is achieved. And of course, they've developed a PCR test, very important nowadays. And so one side of it was COVID-19. And despite the ostensible downturn in business activity and a degree of productivity during the pandemic, they have managed to, in no other words, crush it during 2020. 7 new molecules moving to clinical studies. This is unrelated to COVID. And that's compared to 3 over the last 4. So 3 per year over the last 4 years, 7 in 2020. Very promising. And 4 new authorizations for medicines in 2020. And 19 new medicines have been filed for approval in 2020. which is a record, by the way. And these examples are not meaningless within themselves. They show that Roche is fully committed to continually keeping their cycle of products moving and harnessing the creative ideas they may have to weed out the poor ones and to uplift whichever one will, make a positive intervention in patients' lives. So 2020, their big hitters were in two departments, cancer and spinal disorders. So one called Enspring, subcutaneous, so that's an injection under the skin. First and only preparation for a condition called NMOSD, similar to muscular atrophy, and then also EVDSD, which is a treatment for spinal muscular atrophy. And then when we look at the cancers, there are two more there, one for lung cancer and one for breast cancer, specific types. And these, to me, show that Roche is not shying away from research in everyday diseases during this time of crisis. And so that's very encouraging, I believe. And we can get into their financials now, which I believe is certainly an area you two enjoy talking about.
And I mean, Lukas, before you jump into the financials, perhaps, if we just touch on the actual medical and innovation side briefly, maybe ask you a few questions.
Sure.
I mean, the first thing I want to say is simply about your thoughts as to how you think this company's going to react. So, COVID-19 gave some very decent tailwinds to the company in terms of the COVID side, but with a recovery on the horizon and kicking in, to what extent do you think it might even see some further tailwinds actually from the recovery itself? Especially you mentioned the cancer, the oncology section of the business. To what extent is the pickup of cancer diagnostics, which have been severely delayed over COVID, potentially going to be a massive boost?
These patients that have unfortunately not been able to receive the respective tests or treatments for cancer that they would have received during the pandemic are now coming back slowly, of course. But whichever way you look at it, if they came back in one block, that's an instant revenue stream for the company. If they come back in a slightly thinner flow, but over a longer period of time, that gives stability to the company. And so, whichever way you look at it, this backlog of patients or in health services exists. And so Roche will, of course, profit from that. They will pick up on that and they'll make positive interventions. And so that's a positive for me.
So I have a question regarding Roche's involvement in COVID-19 treatments. So firstly, do you think it's likely that as vaccination rates increase in many countries across the world, that the revenue the company is receiving from these COVID-19 treatments will start to dwindle? And if these revenue sources do dwindle, do you think that Roche will be able to pick up that lost revenue in other areas?
I think that the human need for treatments for COVID will decline simply as a result of the vaccine's existence and its remarkable efficacy. However, I would put my money on governments around the world deciding to be cautious and investing in more further treatments for COVID-19, regardless of whether it seems medically necessary. And so, of course, it is the government contracts that matter to the pharmaceutical company, not necessarily the raw human demand, as this is how often these treatments are purchased. And so there will be a small decline with agreements in place with governments. With regards to the shortfall, will they be able to cover it? Well, yes. No matter what, they still seem to innovate in a way which yields pharmaceutical products that are desirable due to their medicinal value and that are able to be developed by their researchers and are able to be refined by other people in their company.
And speaking on that topic as well, in terms of the current pipeline, the research and development pipeline, how is it looking? I mean, you mentioned a lot of new chemicals that were produced in 2020. Is there anything big on the horizon for Roche over the next 5 to 10 years, perhaps? Or is that looking too far in advance for a company like this?
The drug development cycle for any pharmaceutical company is long. It's on average 10 years, hundreds of thousands of man hours, hundreds of employees, millions of pounds. And there is, in terms of what Roche has in the pipeline, anything specific, they are too intelligent and well organized to tell us. Lovely as it would be to know that. However, judging from their track record and their stability and their longevity in innovation and research, I would make the prediction that Roche are going to continue to come up with big hitters in the near to mid-future.
Wonderful. I guess, I mean, you're about to go on to financials, so why don't you give us a little bit on that? How is the stock itself performing? What are we looking at in terms of sort of multiples? What are you looking at in terms of returns on capital? Go on, take it away.
Absolutely. Let's begin with the good. Return on capital employed even. From 2016 to 2020, they have averaged it at 33.5%, which I regard as very, very healthy.
It's pretty decent, yeah.
Good,
Yeah, and it's been over 30% since 2016. And then this we compare with their historic growth. Since about 1996, they've gone up. Their stock has gone up 220%. Not insane growth like maybe a Tesla or an Amazon. However, it's healthy, and one would make their money. One would make a lot of money off that. And furthermore, they return a large portion of their drug sales back into research and development, 23.8%. Operating profit and operating margin has grown. These figures are from 2018. And this we can combine with some of their other financials. So price to earnings ratio, 21.25. I regard that as reasonable. And Hubert, how would you say that compares to other companies in the sector?
So yeah, interesting you bring that up. I think one thing we should look at when it comes to the price to earnings ratio is actually how it compares historically to itself. So it's trailed around relatively similar figures since 2016. If you look at the Bloomberg data, this is looking on the slightly more expensive side to history. But that being said, given the fact there's a lot more sort of scope for growth recently, especially with just lots of more confidence during COVID, this doesn't seem obscenely expensive. It really doesn't, especially 21 for a company that's going to benefit from healthcare, again, is a pretty decent level. I mean, if we compare to some of the others in the sector, like GSK or Novartis, or just the sector in general, this is looking on the slightly more expensive side. But if we compare the state of the companies, compare this to GSK, GSK has always had a very shaky pipeline. Investors have never taken too kindly to GSK and has performed exceptionally poorly. But Roche, having performed pretty well as a stock, this is a very reasonable price to be paying right now.
Lovely.
So in terms of the risks, looking forward, what do you think the main risks to the company's performance could be in the sort of near to medium term?
Very good point, Albert. Very good question. Near to medium term is, in fact, one of its weaknesses, one of its risks. This is not a short-term, high-growth stock, make your money within 1 or 2 years. And there are a few reasons for that. We can look historically. Whilst they do have historic growth, there are peaks and troughs, and peaks in 2000, 2007, 2014. And therefore, if you take a period of, let's say, 2 to 3 years, there is a lower chance that you will profit compared to a 20-year period. And so investors should note that. And moreover, by way of it being a pharmaceutical company, this is not, they do not produce mass consumer goods that can be shepherded to the market very, very quickly. There is a cycle, there is legislation that regulates how their products, pharmaceuticals, can be tested and marketed, which means that you are reliant on there being a good idea each year. However, on the other side of that, there is a positive in that once a product is established and it sells well, its assuredness and its proof of being able to work is guaranteed.
Yeah, I mean, people aren't going to stop taking their cancer treatment.
Or their antidepressants, for that matter.
Antidepressants, yeah, I mean, pretty much we're dealing with a very sticky product. I mean, on this podcast before, we have discussed products that like to stick around, that consumers like to consistently take year after year. This is very defensive. Whether the economy has gone through the roof or it's gone through the sea, like just gone down through the floor, people will still take their medicine, which is very good. So.
Fully. And defensive leads me onto my third point, in fact, Hubert, and that is it being a Swiss stock. And there are many aspects to consider here. We can start with the defensive nature of the Swiss stock market. The Swiss economy and business arena is known to be very stable and very healthy, and the reasons for this are clear. The country has a low rate of inflation, 2.3% between 1956 and 2021. Very healthy public finances. Debt to GDP in 2020 being 42.9%, and it peaked in the early 2000s. In fact, healthy net decline since then, which gives you confidence, I believe, for any investor. Its labour force is kept under control in the sense that they are paid well and strikes are very infrequent, high export rates and low unemployment. And this is also evident, and this business-friendly environment is evidenced by the fact that the Swiss stock market has a market cap of over $2 trillion, which compared to Switzerland's population is quite enormous. And we must also mention the currency with which this stock trades with. Swiss franc. Swiss franc is a highly desirable currency, very strong and very liquid. And so we can evidence its growth against the dollar. In 1985, you could buy 1 Swiss franc with 36 cents, US cents. And in 2021, you can buy 1 Swiss franc with $1.07, which is a growth of 198% in 36 years. And this, of course, can be repeated for the euro, it can be repeated for the pound. Excellent growth in the tens of percents over multiple years. And therefore, even if this stock were to be stagnant, which I don't believe it will, I think it will grow, but if it were to be stagnant, the Swiss franc would still deliver your returns as a result of it growing itself. So in order for the stock to fail, the Swiss franc would have to drop and the stock would have to drop as well. Or at least the probability of failure is lower as a result of the Swiss franc.
Actually, on that note, just to sort of briefly touch on the FX risks here. On the one hand, you do have the potential that you might benefit from an FX capital gains on this. However, you did mention this is an exporter. This sells its medicines all over the world. Now, I want to ask you a quick question because I don't know this. Is Roche a company which has its manufacturing plants in Switzerland and it exports out? And and if so, surely a rising Swiss franc is going to be a detriment to the exporting potential for the actual products themselves.
I suppose you could say with the foreign exchange that even if it is manufactured in Switzerland, because it's such an inelastic product, people need these treatments and need these drugs. Because of the nature of this product, its demand is much less vulnerable to changes in the foreign exchange.
Yeah, I mean, we have a fair point. The elasticity does look quite good in terms of even FX movements. On that note, is there anything else you want to touch on the Swiss economy?
Well, you mentioned the export market issues of a strong Swiss franc, and the Swiss National Bank has realised this over the years, such that in 2011 they pegged the value of the Swiss franc to the value of the euro. 1.2 Swiss francs to €1 as a result of international investors flocking in and buying up Swiss franc, which pushed its value up. And they removed that peg in 2015. And this to me shows that the Swiss National Bank is in a position to regulate that aspect of the Swiss economy very effectively and to keep the Swiss economy and especially its export market healthy. And so that gives me confidence in this stock.
So yeah, I mean, I think especially in a time like this, we have a lot of speculation in the markets. I mean, Albert, this is something you could probably just touch on a little bit more. There's sentiment across the street, literally, within banks and even retail investors themselves, of the instability of the current debt situation, the instability of currencies in the UK, in America, and it seems like Switzerland is a nice position outside of that in a way. I mean, Albert, maybe you can touch more on this because this is something you know quite a lot about.
Yeah, for sure. I mean that a huge number of the traditional reserve currencies, especially the US dollar, have undergone over the COVID period so much printing, effectively, that yes, a lot of investors are becoming concerned about keeping their money in these currencies, and I think that certainly relative to other currencies, the Swiss franc is in a very strong position, which could help attract investment.
So the final point on this is, Lukas, we've discussed the innovation of Roche, but does that make it a better investment than simply a Swiss ETF, investing in the Swiss market itself? What about this company gives you even more confidence than just betting on Switzerland itself?
I'd start off by saying that I think it's a good idea to bet on Switzerland doing well in general. I would have absolutely no reservations on recommending someone to buy this stock in addition to a Swiss ETF, as a result of the Swiss ETF offering that Swiss franc, as well as an entire scoop of the Swiss economy, a slice of stability, of pure stability, of Swiss reliability. With regards to Roche themselves, what they offer is the innovation, the extreme innovation that reaches around the world as a result of their size, their consistent research and development and how they've increased that during the pandemic. Dividends, small reason, but many are interested in it. Many do like that reinvestment potential. And the fact that they have grown more over time than the Swiss stock market. And so if we compare the historic growths of the Swiss stock market versus Roche, if you put your money in Roche, you would be better off. So that would be my consideration.
Lovely stuff. And just a final note from me on a similar sort of idea. Many investors like to hold Roche, but many also like to hold Novartis, and very few seem to hold both. Now, from my understanding, they're both fantastic pharmaceutical companies, but is there any reason why we should hold Roche over Novartis in your opinion? Or would you say it is simply a matter of personal preference and maybe risk appetite?
I would rarely say it's purely a matter of personal preference. One should always do their research on an entity which they put their money into. I wouldn't say there's anything wrong with holding both, in theory, since you would be holding a large slice of the Swiss pharmaceutical industry. And in general, that has been a burgeoning, stable and profitable industry over the years. However, I do understand that an investor may wish to pick one, in a sense, to simplify their investments. Both are good investments. I would pick Roche purely because of their medicine development during COVID and how they've simply continued their regular practices despite the global situation, and how the pharmaceuticals they produce are highly specialized. And as time passes and cures for more diseases are found, the diseases that remain uncured are often the most perplexing and need a more complex solution. And I think Roche edges Novartis in offering that.
Right, and I guess on that note, I think we should bring today's discussion to a close. A really big thank you, Lukas, for coming on today. It is nice to have a different point of view, someone of a different background come on and have a chat with us. Really entertaining discussion.
Well, thank you, Hubert, for inviting me on, and thank you for your very insightful questions, Albert. It's been a pleasure.
It's been a pleasure having you.
Yes. I mean, do come on soon if you come up with anything else you'd like to chat about.
Absolutely.
But we really hope all of you enjoyed today's session.
Let us know your thoughts on this week's picks in the comments or on our social media, and send us any questions that you'd like answered.
And I mean, if any of you have a suggestion of a stock we should cover, as always, please let us know. We would love to hear your suggestions, and see you next week for another episode.